Brought to you by Summit Medical Group.
Welcome back to Life and Living. Did you know that 1 in 5 people struggle with mental illness? And as hard as it is to talk about it as adults, it's even harder to talk about it when it's your child. Joining us right now is Richard Hlavacek, chairperson of the Child and Family Advocacy Committee of the Mental Health Association in New Jersey and executive director of Families and Community Together. Welcome to the program.
Thank you.
Before we talk about the Mental Health Association in New Jersey, first tell us, what is Families and Community Together?
Families and Community Together is a care management organization. It's one of 15 in the state. It's part of the Children's System of Care, and our mission is to help families navigate the mental health system, get the services they need, and provide support and advocacy.
Can it be hard for families to navigate this world and understand what mental health problems are, understand how to treat them?
I think the complexities around kids are difficult in particular. I think when you're talking about very young kids, parents are often unsure about developmental issues. They see a child who maybe is interacting very aggressively with his peers and wonder if that's normal or not.
Is that normal?
I think these are conversations you might want to have with your pediatrician.
Mm-hmm.
You know, when you describe situations like that, I think you want a little bit of feedback.
What would you say to the parents who are watching? What are the signs and symptoms of some mental and behavioral issues in your child?
Well, I think there's different issues at different ages. You know, I think for young kids, you really are concerned about child development and socialization. That's a conversation with a pediatrician. Mm-hmm. I think as you get to school age, you start looking at other things. Learning issues, interaction with other kids in the class, sometimes developmental issues. These are conversations that parents ought to have with school personnel, school psychologists, school social workers.
So is that the answer? If a parent thinks that their child might have some kind of emotional issue, is the answer to go and talk to the school advisor, to a medical professional?
I think that's definitely the first step. I think because mental health is such a broad description of behaviors, I think parents need to talk to some of these professionals about getting a focus on what exactly is happening. When you talk to school personnel, you may learn about things like learning disabilities, for example, and maybe the solution is sort of a tutor or a different classroom. Or maybe there's something more emotional going on within the family. I think these professionals can recommend good family therapists or individual therapists. There's lots of great options.
Is that often the answer? Therapy, counseling, talking it through with the child?
I think talk therapy is often the first step, and it's a very good one. It doesn't have to be a long, elaborate process, but you know, there are social workers, licensed clinicians who can provide some real guidance when you're not sure what's going on with your child.
You know, it's interesting. We talk about early detection for so many physical disorders, but why is early detection so important for mental illness?
Well, you know, it's actually pediatricians are required to do a kind of a review of developmental stages with kids, and there's a little section that actually makes reference to behavioral health needs. I think there are opportunities for parents, if they're not frightened by that or overwhelmed, to ask questions about their child's development.
Is the risk of the problem worsening greater if there's not early detection?
Yeah, I think just like a physical illness, you know, if you kind of drift into a kind of denial, or maybe this will get better and I don't think I really want to talk to a doctor about a problem, there's a good chance that that particular illness could escalate and cause greater problems going forward. So it's always good to kind of get in there early. I think a lot of issues around emotional and behavioral health can be remediated. There's some great programs out there for little kids. There's Therapeutic nurseries, which will help kids around development.
So nurseries geared towards a specific developmental or emotional issue?
Yeah, these are like special situations within schools where they have a lot of one-to-one services for kids.
Is there a shortage right now of physicians?
There's a huge shortage of child psychiatrists, and I think that's why some organizations are moving toward advanced practice nurses to do some of these things. We know that for some of the older kids, medication can be very effective, ADHD, other kinds of behaviors. But I think medication in combination with talk therapy is really the way to go.
And I want to give you a chance to talk about the Mental Health Association in New Jersey. What is it and what is its mission?
Well, it's a great organization. I've been on the board for a few years, and we've just started a children's committee. We've been meeting a few times. It involves parents, people from different counties, and some providers. We've identified issues that we'd like to learn more about through the Mental Health Association. Issues like being culturally competent, for example.
Explain what you mean by that.
Well, since talk therapy is really a big part of mental health care, having someone who speaks their language, or even better, speaks your language and comes from the same culture, is kind of the ideal partner as you're talking about sensitive issues.
Makes people more comfortable?
Not just that, but sometimes there's even words that are hard to translate,
Right.
and from one language to another. So there's a big shortage, especially of Spanish-speaking therapists in New Jersey.
Richard Hlavacek, I appreciate you coming here and talking about this. We really need to destigmatize this issue for families, not just in New Jersey, but around the country, the issue of mental health.
For whatever reason, families are very frightened. Our care managers actually go out to some homes and they've been told, don't park your car in front of our house. We don't want our neighbors to...
We need to change that culture, don't we? Richard Hlavacek, Mental Health Association in New Jersey, thank you so much.
You're welcome.
Also brought to you by the Mental Health Association in New Jersey, New Jersey Sharing Network, and by the Give Something Back Foundation.